Well, we were very prepared. We were very ready for this baby number two. We had done all the preparations, taken a couple of classes. When we arrived at the hospital, we were scheduled to be induced that morning. Everything went normal. Everything was going fine. We brought our bags in. Kevin was feeling fine that morning. And we were probably about 3 hours into labor when Kevin began to feel some dizzy symptoms, some dizziness. And he had felt dizzy in the past, so at first we weren't sure if it was something that we should be concerned about or not, but he also had a little bit of vision impact. So we had relayed his story to our delivery nurse, and she thought, well, with his history, maybe we should take his blood pressure, and his blood pressure was elevated. So they wheeled Kevin down to the ER. And at this point, we were probably about 4 hours into delivery. They decided in the ER to run some tests, including another MRI, and at that point in time, they found that he had suffered a stroke while we were in delivery. So they continued to keep him down in ER, and I continued to labor and delivery. And the entire time that we were separated and both receiving individual separate care, our nurses kept in contact with one another, and the labor and delivery nurse that I had kept going back and forth to the ER to check on Kevin, make sure that he was doing well, make sure that she was keeping the ER nurses in touch with where I was with my progress.
And the thing that was so interesting is that everyone in the hospital seemed to know, whether it was nurses or doctors, everyone knew our story. And obviously it was a story that doesn't happen very often, but they did everything within their powers to know that this was a key part of our life and that they wanted to get me back up there. But at the same time, they knew that I had just suffered a stroke and we couldn't do this lightly. So from the time that I did go down and run the test until the time that I came back, to have a nurse that would actually run through the halls with you and spend that time with you and say that, this is something that you need to be a part of, and I'm just going to sit here and be a part of it, was very important for us. So I can't emphasize enough what it was to be cared for in that fashion. When you are not able to be there when your child's born, I mean, there are situations where maybe that can happen, but in mine, the people made us feel like they wanted this experience to be as important as it was. And we feel very, very passionately about those individuals, and it wasn't just one or two, it was several that it just carried through. There's something about the culture of the people that we worked with here that made a huge difference in our lives.
We do say that Kate saved Daddy's life because we were in the right place at the right time, and we received phenomenal care. And although open heart surgery, a stroke during labor and delivery followed by open heart surgery just days after your second child is born is not something you ever want to experience or wish on anyone. It couldn't have been a better experience for us overall.
Yeah. It
could have been the most traumatic experience of our life, but instead we have an amazing birth story for our daughter, and we look back and think that God was really with us and watching over us, and we were where we needed to be.
And I think the thing that we've taken away is that so many people go through life and at 60 or 70 have an experience that they say, I'm going to live life to the fullest. And we had that at 32. We weren't sure how things were going to turn out, but we had the perspective that we're going to, something very serious has happened, and we've been blessed with another chance, and everything is back to normal. But our perspective is that we're going to live every day to the fullest and appreciate the little things and not take for granted the things that maybe you don't realize you have. One of the things that was important to me that I realized, the new facilities are phenomenal. And when we came up to the cardiac center, the flat screens on the walls and all the things that we were going through, that setting, that private room, that seemed to make a big difference.
It was
typically in a
hospital
you don't think about your settings, but the new wing and all the advancements that have been made here, that made the healing process better. And I just want to compliment the hospital on those changes.
Something that you don't necessarily think about when you're going into the hospital or as a patient is how important it is to have your support around you, your family, your friends, your pastor, chaplains, whatever. And hospitals don't always make accommodations for the support team. And in order to heal and get home, you really need to have your support around you. And the new wing of the hospital provides for that amazingly well. You know, there was a pull-out couch that we were able to sleep on every single night. The surgery waiting room, oh my goodness, it was so well equipped, and the staff down there were so helpful. And to be able to see on a flat screen monitor at all times where Kevin was in the process of surgery.
Did?
Yes,
Didn't know
knowing
that.
that he was either prepping for surgery, in surgery. I think another status that we received was that he was recovering. And just to be able to have that information and knowledge at all times was so reassuring, and especially, you know, just days after giving birth and checking out of the hospital myself, that was really important. And being able to sit with him every day was, I think, got us home that much faster.